This is a section on heart failure. Heart failure is an increasingly common problem in today's society. It's basically a situation where the body's heart is unable to keep up with the demands of the body. It presents often with shortness of breath, sometimes with exertion, sometimes at rest, and fluid build-up, sometimes in the ankles and sometimes in the tummy. It can also present with just fatigue and lethargy and dizziness. Common causes include previous heart attack, valvular heart problems, high blood pressure, and heart rhythm irregularities such as atrial fibrillation. Treatment usually involves medication, but sometimes involves surgery, particularly to the heart valves, which may be either leaky or narrowed.
So one of the basic things that I'd be talking about with someone with heart failure would be the advantage of learning to manage their fluid levels. And the best way to do that is to weigh themselves every day, so that we know that 1 kilogram of body weight equals 1 litre of fluid. So that if you're weighing yourself every day and all of a sudden your weight starts to dramatically increase up to maybe 1 or 2 kilos than it was a couple of days ago, you might have some swollen ankles and you might have some breathlessness. That would tell me that you're putting on extra fluid. And depending on what your management plan is, it would be maybe that your cardiologist has suggested to take an extra water removing tablet at that point in time. I would suggest that you would reduce your fluid intake for a couple of days and make sure that you're not having a lot of salt in your diet.
What happens with salt in our body is when we eat a lot of salt, like if you've ever had a very salty pizza, you immediately go looking for water, and that's our body trying to dilute that level of sodium, which is another word for salt, in our blood. So what happens then is we've got a lot of fluid in our blood vessels, and that puts a lot of pressure on our blood vessels as well, and it increases our blood pressure. And an increase in our blood pressure means our heart has to work harder, and it's more of a risk factor for our heart, particularly if it's a chronic thing. It happens over a long period of time. So by reducing salt in our diet, we can help to reduce our blood pressure.
I take 2 water tablets first thing in the morning, which is house painting. You can't do anything till after midday or 2 o'clock in the afternoon, and then the rest of it is just blood pressure and a couple of other tablets.
People talk about the idea of medication management aids. One of those such things is called a dosette, where they'll actually have a box which has the days of the week along the top, and in fact, so Monday through to Sunday, and has compartments for the times of the days, whether it's morning, lunchtime, tea time or bedtime. And you can simply put your week's worth of medications into that box.
What we want to do with people with heart failure is to make you as active as you possibly can be given your circumstances. And it might mean that we start you off, for some people that are quite frail, just simply doing some exercises in a chair, moving their arms and their legs. The importance of exercise can't be overestimated. It's huge in terms of keeping you well. So even if you can go for a walk every day, it might mean that you can walk up and down your driveway or up and down the passage at home to start with and gradually build it up. But ideally, to incorporate some aerobic activity, some walking or cycling, and then some light weights.
We want to encourage people to take on a level of exercise that they can continue on with as a long-term preventative strategy. The exercise that we'd be advocating for is a low to moderate intensity exercise that is able to be done independently in the community.
One of the books that we recommend that every patient with heart failure gets access to is this book called Living with Chronic Heart Failure, that the Heart Foundation have developed for consumers as a self-management tool. Now this is available in a hard copy, or you can actually download it from the website as well. And it is available in a range of other languages, which I think is really important to have it specific to the individual. And the reason that I think we like to use it is it's got a very clear action plan that helps patients to understand their responsibilities about what they have to do every day, when to seek help, and when to know that it's an emergency. So I think that's a really good outline, and a lot of people put a copy of it on their fridge, put some magnets on it and put it on their fridge at home, because it not only reminds you, but it reminds your wife or your husband or your family what to do in the case of an emergency. So I think that's a really good resource that you should be having.